Hello everyone, welcome back to Physics Medical Science channel. In the last episode, we briefly talked about what TNM staging means in cancer and how oncologists use TNM staging to determine the stage of a cancer. And at the end of the previous video, I mentioned something very important, that cancer staging plays a huge role in guiding treatment decisions because different stages of cancer often requires very different treatment approaches. So, in today's episode, I want to briefly introduce the three most classic cancer treatment options: surgery, chemotherapy, and radiotherapy. And in this first episode, we're going to start with the one that people are probably most familiar with: surgery. A lot of people might think if there is a tumor, can we just remove it? But in reality, it's usually much more complicated than that. Before deciding whether surgery is appropriate, doctors first have to ask an important question. Is this patient actually suitable for surgery? In many cases, the main goal of surgery is curative treatment. In other words, to completely remove the cancer if possible. That's why surgery is usually most suitable for patients with relatively early stage cancers. For example, when the tumor is still localized within original organ and there's no obvious distant metastasis, because surgery is fundamentally a local treatment. It works best for tumors that are visible, localized, and technically removable. So for many early stage cancers, surgery can potentially achieve a cure. But surgery is not always performed with a goal of cure. Sometimes the goal is actually to improve patients' their quality of life. For example, some cancers may have already spread within the pelvis. The tumor may become very large and start compressing the intestines, causing bowel obstruction. Patients may struggle to eat, experience abdominal pain, or feel extremely uncomfortable. In situations like this, after weighing the risks and the benefits, doctors may still consider surgery, but this type of surgery is not necessarily intended to cure the cancer. Instead, the goal is to relieve pressure, improve eating, reduce pain, and more important, to improve quality of life. This is often called debulking surgery. On the other hand, not every cancer is suitable for surgery alone. For example, in some advanced cancers, the primary tumor may have started in the lungs, but cancer cells have already spread to the liver, bones, lymph nodes, or intestines. And some people may wonder, why not just remove all of these tumors by surgeries? But the problem is that imaging scans like CT scans can only show us what is currently visible. Cancer cells may have already spread to other parts of the body, but are still too small to detect. So even if surgery is performed, it may not truly eliminate all of the cancer. Instead, it may simply increase surgical wounds, infection risk, and physical stress on the body, especially because many patients with advanced cancer already have relatively poor overall health conditions. So in these situations, surgery is often not the preferred treatment options. There are also certain cancers where surgery is not usually the first choice, even in relatively early stages. One classic example is nasopharyngeal cancer. Because the nasopharynx is located very deeply, surrounded by important structures such as major blood vessels and nerves. This makes surgery technically difficult and potentially risky. So for these cancers, radiotherapy is often a much better option, and I will talk more about radiotherapy in a future episode. Another example would be lymphoma or blood cancers like leukemia. These are usually considered systematic diseases, meaning they affect the body more broadly rather than forming a single isolated tumor. So surgery alone is generally not very effective in treating them. Speaking of cancer surgery, there is another important medical term called negative surgical margins. It sounds complicated, but the idea behind is not that difficult. So let's use a simple example. Imagine there is a tumor, and on a CT scan, it appears to be about 3 centimeters in size. Well, can we just remove all those 3 centimeters? But the problem is that cancer cells are often not very well behaved. Sometimes they may have already spread slightly into the surrounding tissues, but they are too small to be seen on a CT scan or with our naked eyes. So when surgeons perform cancer surgery, they usually don't remove only the visible tumor itself. Instead, they often remove a small amount of surrounding normal tissues as well. Now, if the edges of the tissue removed during surgery do not contain cancer cells, this is called negative surgical margins. And it usually suggests that based on what we can currently see under the microscope, the tumor has been removed relatively completely. However, if cancer cells are still found at the edge of the removed tissue, this is called positive surgical margins. And that means there may still be some cancer cells remaining inside the body, which can increase the risk of recurrence in the future. So in these cases, additional treatments such as chemotherapy or radiotherapy may also be needed afterward. However, surgery itself can also cause side effects. For example, pain, bleeding, infections around the wound, and scarring after surgery. And depending on the location of the tumor, surgery can sometimes affect important body functions as well, especially in brain surgery. So now, surgeons are not always trying to remove as much as possible at all costs, because some areas of the brain control functions such as speech, movement, and the memory. So, cancer surgery is often a balance between removing the tumor and preserving the patient's functions and quality of life. So, that's a brief introduction to cancer surgery. And in the next episode, I will talk about chemotherapy, what it actually is, and why chemotherapy can cause hair loss. So, see you next time.